Hello everybody, my name is Marie Kilduff, Interim Director of the National Clinical Leadership Centre for Nursing and Midwifery, Office of the Nursing and Midwifery Services Director. You're all extremely welcome to our 7th webinar, Nursing and Midwifery Clinical Leadership during COVID-19, sharing the learning from Intellectual Disability Services. I'm delighted today to introduce our expert panel, Ms. Gronya Burke, Director of Nursing, St Michael's House Intellectual Disability Services, Dublin, Ms. Evelyn Reilly, Advanced Nurse Practitioner Candidate in Dementia and Intellectual Disabilities at the Daughters of Charity and the National ID Memory Service, Tallaght University Hospital. Ms. Majella Meehan, Clinical Nurse Manager 2, Cavan Monaghan Disability Services, and Ms. Neve Walsh, full-time PhD researcher with Ulster University and the NMPDU Northwest. I'm also delighted to welcome my colleague, Dr. Clare Lewis, Deputy Chief Nursing Officer, and Clare will be taking notes throughout the webinar and will provide a summary of the key points raised at the end. So without further ado, I'm going to introduce our first panellist, Ms. Gronya Burke, and Gronya, you're extremely welcome. As I said, Gronya is Director of Nursing in St Michael's House Intellectual Disability Services in Dublin. Gronya, I'm sure our listeners would be really interested to hear what is your lived experience of being a director in your position in intellectual disabilities over the last 9 months? And I suppose we particularly would love to hear about your leadership style and how you led out during this time.
Thanks to you, Marie, and your team for the opportunity to present here today. While I'm here in the context as the current chair on behalf of the Irish Nurse Managers in Intellectual Disability, as you said, I also work as Director of Nursing in St Michael's House. At the outset, I would like to acknowledge the significant work in Intellectual Disability Services to keep people safe and well during this time, in conjunction with our nursing colleagues, social care and clinical departments. I would like to acknowledge the resilience and creativity of service users and staff, families during the pandemic. Disability services to date have done extremely well, perhaps quietly, but many have been through several outbreaks which have ended successfully. This is against a background of international evidence from the World Health Organization, which states that people with a disability may be at greater risk of contacting COVID-19 because of the following reasons. They may have barriers to implementation of hand hygiene measures, such as hand washing. A person with a physical disability, rubbing their hands together thoroughly. They may have difficulty enacting social distancing because of additional support needs. They may have sensory difficulties. They may have the need to touch things from their environment for physical support and comfort. Many have different ways to communicate. Depending on underlying conditions, people with a disability may be at greater risk of developing more severe cases of COVID-19 if they become infected. This may be because it exacerbates their current physical health conditions, particularly those relating to respiratory issues, diabetes, heart disease. IDS Tilde in Ireland also acknowledged that people with an intellectual disability are 71% greater multiple comorbidities, and that these morbidities often start at a younger age than the general population. Older people with the Down syndrome are particular risk for, as many have pre-existing conditions, such as cardiovascular and respiratory problems, confounded by a 55% risk of dementia in those aged 55 years and older. And I know my colleague Evelyn will discuss this in greater detail going forward. Leadership style, you've asked about that in the outset. We all know the various leadership styles that are espoused in the literature. I would hope that I was a type of leader that was approachable, bring people along with me, have a team around me, a leader that would foster and recognise talent, and always be an advocate for service users, especially ensuring healthy ageing in place.
Gronya, as you speak about your leadership style, every single aspect there is key to leadership in normal times, but I'm sure particularly during this pandemic. And as you speak about service users, I'm just wondering, how are the service users and how have they managed during COVID-19?
Staff in intellectual disability services have met the same challenges as our colleagues in other disciplines, but we also have additional challenges. While wearing of PPE, the face mask may create additional difficulties for service users with lip reading or their inability to see facial expressions when using sign language. We also have to ensure that the information around COVID-19 is accessible and disseminated to people with a disability and their caregivers so that they are aware of the potential health and social consequences of COVID-19. Many of our cohort live in ordinary houses in our community, so there's many sites that we have to communicate this information to. In March, all day services closed. I do acknowledge that they have opened, albeit with lesser capacity. We recognise that the impact of these closures have. Older people with an intellectual disability have fewer social networks and fewer social supports than the general population. So this disruption to their day service and their routine and contacts because of COVID-19 place them at greater risk of social isolation and loneliness, and potentially leading to poor mental health outcomes. Many have missed holidays. Many have missed meeting with their friends. Delivering sufficient support for people with a disability with more complex needs, particularly if they've been quarantined or isolated, adds to this. When needed, we've had to coordinate care between health and social services with families and their caregivers. People living at home with aging parents themselves are among the highest COVID-19 risk groups. As Professor McCarran would have said, this is a real worry about what might have happened if someone in the house becomes ill. And that's why it's so important to put those supports in place. People with an intellectual disability who are vulnerable to the COVID-19 depend on these support in their everyday life. Our psychiatrists and our clinical nurse specialists in mental health have seen a rise in requests for psychotropic medication to support people and to assist families and caregivers to manage behaviours that are challenging to them for all the reasons outlined above.
And Gronya, as you outlined there, the changes to the routine of the lives of service users, it has been really, really difficult for them, like so many with COVID. But I suppose just even the absence of the day services in the very beginning and the inability of being able to go home and things like that has been really, really challenging. And I know when we spoke before, Gronya, you were telling me how the staff responded to these changes and supported service users, and there was a lot of learning in that journey, so to speak. Could you talk to us about that?
So perhaps at this stage I could give a flavour of what nursing IDs have supported. I'm going to give examples from St Michael's House, but I do know that they're replicated right throughout the country. So what we did in March is that our clinical nurse specialists came together and we decided we'd put up a dedicated coronavirus health information phone line for children and adults with a disability and for staff supporting people with a disability so that they would have a deep understanding of COVID and COVID related issues. And like many of the population, we learnt as we went along. We are very conscious to date, and I looked at the statistics just only last night. So we've over 3,500 calls to that phone line since March, which is quite significant, and the support that was needed. We were also there to support the reopening of day services. So as I said previously, day services had closed. Also our respite, our linked and our community support services closed. So we supported them going forward. Like many other services, we set up a 6-bedded non-acute isolation unit. So this was in one of our day services, again supported by HICWA and the regulation, but this was to support people who are suspected or confirmed case of COVID, who were unable to isolate in their own environment. As I said previously, these are people who are living in ordinary houses in the community, and often it is difficult to isolate when you're living with other people. We also developed videos around PPE and hand hygiene. We do know there were many of those made by the HSE. However, we're very conscious that the PPE that we had was not similar to those videos. We also developed webinars that were able to reach many people right throughout 80 community houses in our area. We also developed a hospital passport to allow for acute hospital transfers. At the outset, we bought 4 high-low beds, and again with the view to keep people out of hospital, to date, which we have successfully done for 4 people. We provided additional training around COVID-19. We also developed what's called a My COVID House Plan, which was to prepare people in advance for COVID, so that once a suspected or confirmed case came into the house, they were prepared. So things like donning and doffing stations, pedal bins, entrance and exit, etc. And also, we also updated our policies and developed new policies in line with COVID-19.
Gronya, a massive amount of work in such a short period of time, and you know it's wonderful to hear. And I know from speaking to you before, your service users were involved in the responsiveness, which is really key. As you know, it's nothing about me without me. You know, philosophy was very much in part of the service during the last few months. Gronya, as you know, you're in a key position here as a Director of Nursing and Intellectual Disabilities, and also, as you said, you're the Chair of the Irish Nurse Managers in Intellectual Disabilities. And there's a lot of people listening today from Intellectual Disability Services and indeed other services. I'm just wondering, is there a message you'd like to give in your role as a very senior leader?
So there's a couple of different messages, and I might do this by way of thanks. So I would like to acknowledge the support of nationally and internationally. We just had to put a call out via email for a number of different supports, and everybody got back immediately, and that was hugely beneficial. We worked closely with our colleagues both in your department, Marie, and also with the Nursing Midwifery Planning Development Unit, and then under Ger Shaw in the ONMSD. We also work collaboratively with Judy Ryan and Mary Kyo Sullivan, who are leading out and shaping the future of ID nursing. We link closely with the university to support student education. As you know, many of the students worked at health assistant for a period of time, and then looked to reintroduce them to make sure that they met their requirements for their nursing programme and to continue. I can give an example where the call went out to look for 20 nurse placements for student nurses in children's services to fulfil that requirement. Within a couple of hours, those places were filled. So that is down to the people that we work with. This has been a time and an opportunity for people in ID services where we have worked collaboratively with our national colleagues on policies and directives, and we've inputted to many of those. It also has been a time of innovation and creativity. Many have set up activity hubs to support that social connectiveness throughout. But also, we have taken on the new ways of working, and I can say we have done so successfully.
Gronya, thank you so much. I think you've really set the scene for this webinar and giving us a really good insight into how services have been, how service users have been, and how staff have supported service users in managing the pandemic. Thank you so much. I'm now going to move on to our second panelist today, Miss Evelyn Reilly. And as I said, Evelyn is an advanced nurse practitioner candidate in dementia and intellectual disabilities at the Daughters of Charity and the National Intellectual Disability Memory Service at Tallaght University Hospital. It sounds like a very big brief, Evelyn, as I'm introducing you there. And I know from speaking to you, you commenced in this role in August, so it's very, very recent.
Yeah.
Could you tell us about the role and a little bit about the National Intellectual Disability Memory Service as well?
Of course, and thank you so much, Marie, for inviting me to be a part of this webinar. It's a great opportunity for me, so thanks again. So my role is quite complex. As you said, it's a new role. So we would see people with intellectual disabilities who have memory concerns or are concerned about functional decline or memory decline. We carry out a battery of different assessment instruments that are suited to their level of disability. We would have close contacts with staff members and key support people and family members indeed who are concerned about their loved ones. We provide baseline screening for people with Down syndrome and this is crucial, baseline evidence is crucial for measuring change over time. And we in particular look at, and very important in the role of an advanced nurse practitioner, we look at differential diagnosis, outruling treatable conditions like hypothyroidism, B12 and folate deficiency, depression, which is very common nowadays with COVID. And we look at drug interactions, and particularly polypharmacy, as this is so big in intellectual disability. We would make referrals out to various members of the MD team as necessary. And the most important and critical thing for people with ID and dementia is we provide hope. And there's so much things we can do for people with ID and dementia, supporting families, supporting the person themselves, and help them along their journey of dementia to live well with dementia.
Evelyn, it just sounds like it's wonderful to see the service up and running, because it's so necessary, and it's brilliant to see somebody who's such expertise in the area leading it. So I suppose I'm just thinking, Evelyn, you know, you started in your new role and the service really, you know, grew during COVID-19. I'm thinking dementia is a very difficult diagnosis in normal times, but I'm sure in the midst of a pandemic, it's particularly difficult. Could you tell us a little bit about how COVID-19 has impacted on those with dementia?
Well, we find that so many people with intellectual disability need routine in their life. People with ID and dementia are even more complex. For many service users with dementia, the disproportionate impact of social distancing has been particularly huge. Physical proximity to caregivers and loved ones is required to bridge the gaps in intellectual and communication abilities for this population, and indeed to make their day-to-day life fulfilling, predictable and manageable. It's important to note that people with dementia, their lives are profoundly affected by memory loss. Routine is so important to this population, and the lockdown has escalated levels of confusion and indeed their coping skills and their day-to-day management of day-to-day life. People with ID and dementia are typically very demonstrative and very affectionate. Social distancing, not being able to hug their caregivers, their peers, has been very challenging, and considerations need to be applied to mental health. And we have seen a huge escalation in depression in people with ID and dementia. Day services which have shut down. Limited access to family members has been huge for this population, and that has impacted on people with dementia in particular. On the positive side, some people have managed very well during COVID. They have more free time to manage their hobbies and skills. They don't have to get up out of bed early every morning for work. So it has been positive as well.
And, you know, it is important to look at the positive as well. But I mean, I suppose there's a lot of learning as well, Evelyn, from what you've presented on the impact of the pandemic. And I'm wondering, you know, in your new role with your colleagues,
yes,
you know, what learning has been achieved, I suppose, or that you've really experienced that will benefit the future of your work with service users?
Well, using technology, we've become much more efficient. And we're actually seeing much more people now because of technology. We don't have to go out and visit people so much in their homes because we're trying to reduce footfall. But I suppose one of the key areas of learning has been the value of communication. Keeping in touch. It's important to plan well and to know our resources. We've built up a huge amount of networks through various regions, and it's important to have buy-in from the key stakeholders, from the person with dementia themselves, listening to their presenting concerns and their worries for their future care. And that has been very much highlighted in our various memory clinics. We're keeping in touch with families, key support staff, and indeed keeping really close connections with the MDT has been hugely important through the continuum of dementia in the early stages, the middle stages and the late stages. Particularly at end of life care, we have negotiated services with the community palliative care outreach service, and that has been hugely beneficial in supporting end of life care in people's own homes and maintaining people in their homes with staff who know them well and are familiar with their needs at that time.
It's great. It's great to see, Evelyn, that, you know, the learning will certainly enhance the future of your work in the service. And I'm just wondering, you know, as a senior clinical leader in nursing, in intellectual disability nursing, what would your vision be for the care of service users with dementia in line with the strategy shaping the future of intellectual disability nursing in Ireland?
So, as as an ANP and working with clinical nurse specialists in the National Memory Clinic and at the Daughters of Charity, we're very much committed to implementing service reform through modelling, through leading person-centred care, particularly for people with ID and dementia. The IDS Tilda study has highlighted, along with Professor Mary McCarran, that there are so many people out there with obvious signs and symptoms of dementia, but they have no opportunities to engage in memory clinics. And so there are so many people out there with obvious dementia, as I said, but they have no supports in place. So this is something that really needs to be challenged. So looking at shaping the future, we have to support timely diagnosis and health promotion. We have to look at things like brain health and promoting brain health. We're all very good at promoting physical health, but now we have to encourage people with ID to support their own brain health and build up brain reserve. We need to build on our interdisciplinary supports and cross-sector collaborative roles. We need to support families and carers through the diagnosis. But I think what's really important is we need, from a national point of view, we need to build up satellite clinics throughout the country, north, south, east and west, supporting people, despite their diagnosis of dementia, to have the best outcomes. And what I feel is critically important is that not only do people live well with dementia through the continuum of the disease, but also they have the opportunity to die well with dementia.
Evelyn, I'd like to thank you so much for taking the opportunity to present here today. And it's been wonderful hearing you, because it's such a new service and you're definitely the right person to be working in that area. And it's been wonderful to hear what's happening and to hear how the pandemic will positively impact the future of your work for service users. Thank you so much.
Thank you.
So I'm now going to move on to our third panellist, and I'm delighted to introduce Miss Majella Meehan. Majella is a clinical nurse manager too in the Cavan Monaghan Disability Services. Majella, I know you've been working very close to the front line in the last few months, and I suppose I'd just like to set the context and tell me a little bit about the impact of COVID-19 on your role as a clinical nurse manager in intellectual disability services.
Yes, hi Marie. Yes, I suppose looking back over the last few months, it's kind of been a stressful time, you know, in the community house that I manage. You know, residents have had no day placement. They haven't been able to go home to the family members. They haven't been able to go out and meet their friends, you know, for coffee. So, you know, quite a stressful time, you know, overall, and especially for family members as well, because we've had to look at, you know, residents not being able to go home at weekends, not being able to meet up with family members, maybe after their day placements. So it's been, you know, quite an anxious and you know, upsetting time for residents. But we've been able to sit down with residents at this time and maybe look at their day structure and make their days more meaningful. And I suppose I've been the support network at that time, you know, for residents and family members. So just to be a reassuring, you know, support to them at that time, I suppose that really impacted on my role. Another aspect would have been, I would have worked closely with the multidisciplinary team. You know, during COVID, you know, we had to develop a contingency plan, and not only in relation to COVID-19, but we would have had to look at other aspects in relation to weekly medication orders, visiting guidelines, what if we were going to have staffing issues within the house, and we would have, you know, developed our contingency plan around that, and I would have done that alongside senior members of the multidisciplinary team. And I suppose it's made me more resilient going forward. I feel that I, you know, may have a better understanding, you know, of more challenges in the future, and I've made lasting relationships with senior members and learned from them going forward.
Majella, thank you. You've given us a good insight into how things have been for you in your role over the last few months, and it's complemented, I think, what Gronya has been saying as she gave the strategic overview. You're kind of taking us into the operations. I know from working with you, Majella, it's been really challenging, and there has been a lot of challenges, and maybe you'd like to tell us about some of those.
Yes, I suppose there has been some, challenges that we faced during COVID-19. We, like other families in Ireland, we, as a family network in our community house, we've all been under the roof at the one time, and it's been quite challenging, but we've really had to look and sit down with the residents themselves, and we've taken on the opinions from family members and staff and worked out, what we were going to do to make residents' days more meaningful. So we would have looked at, introducing them into activities outside the community house and get them involved in painting and decorating and renovating within the house. So this has proved, positive. We've turned the challenge into a positive aspect. So another thing as well, information, with regards to infection control was changing rapidly. And I suppose I was disseminating the information to my staff and getting them to do their training on HSE land. So I suppose, each day brought new challenges and changes to policies and procedures. And it was making sure that staff were following the up-to-date guidance. And I suppose I was on the house floor and making sure that I was observing, and if I found any faults, that I was redirecting them back to, retrain in that area. Another aspect and another challenge I would have faced was the loneliness of residents. At that time, they weren't able to go home to their family. So it was quite distressing because they would have been, so used to going home maybe for 1 or 2 nights a week. So I would have introduced Zoom calls. I would have got them involved, with technology and set them up. And now, should there on a daily basis, it's like the norm in our service at the moment. And I think as well, I was able, maybe at the end of resident Zoom calls, able to come in and, pop my head in and, go through maybe any questions that family members would have had, so it was just a real reassurance to family members that I was able to do that and to be able to keep in close contact with them at such a time of crisis.
And I think, Magella, what really has struck me from working with you in the last few weeks and from talking to you today is your presence as a manager and leader in the actual houses with the teams and with the service users. And I'm just thinking, there's been a lot of positivity that you've presented there, and there's been a lot of positive changes. And if COVID was to disappear in the morning, which you all wish it would, and hopefully there's a light at the end of the tunnel with the vaccines coming, what do you think you would hold on to in terms of the positive changes? And maybe you could talk us through some of those.
Yeah, there has been some positives during COVID. I suppose at times we would have been thinking, was there any at all? But yes, when we reflected on it, we have looked back and, for me as a manager, I've got to know my residents a whole lot better. Beforehand, they would have been going off to day placement maybe 4 to 5 times a week, and I might have only got to catch up with them maybe for that hour and a half in the evening time. Whether with COVID, they were at home, I was able to sit down with them and chat with them and get, to know exactly what they wanted out of life and to plan for their goals and aspirations in the future. I suppose as well, we have looked at some of our older residents maybe have come back to me and, because they've enjoyed their time at home, they've said that they might, only go back to day placement 3 to 4 days a week. They find that the time spent at home has been so meaningful. They've enjoyed the slow pace of life, and they feel going forward that they might just take that 1 day a week off so that they can have maybe extra support, at home and enjoy, the slow pace of life. I think another positive is the sharing of information among other services. We, like Evelyn and Gronya said, we had to introduce easy to read documents for residents, and this was to explain, in an easy to read way, that what the pandemic was, what way it was going to affect residents' lives, maybe if they had to go for a test or if they had to isolate in their own room. So we really worked closely with other services and come up with, really good, easy to read documents so we could explain what COVID-19 was to residents. Another aspect, I suppose, was I built up a lot of relationships, good relationships with my staff. And I feel going forward that if I need to bring in any changes into my area of work, that staff really trust me, and I've been a reassurance to them. And I feel that they will really work with me in the future.
And Majella, just listening to you there, you're such a great advocate for intellectual disability nursing. And I think you're in a key position to answer the next question, which is, what impact do you think COVID-19 will have on the role of the intellectual disability nurse in the future?
Yes, I think it will have a major impact. I think RNIDs have had to take the lead in a lot of different areas. I suppose residents also would have had a lot of their appointments rescheduled during the pandemic. I think that digital communication, will be an area that will need future planning. We would have rescheduled our residents' appointments through Zoom, and I think this was really beneficial. And I think going forward that, we will have to look at the digital communication aspect. Also within Cavan Monaghan, we're very excited. We have a new post advertised, an advanced nurse practitioner. And I think this is great for our service. And I think because RNIDs have taken the lead during the pandemic, I think they really should be given the recognition for taking the lead at such a time of crisis. So I think, I also go back to the document shaping the future of RNIDs in Ireland. And I think that a lot of CNS posts will be developed because of the role RNIDs have taken at this time.
Majella, thank you so much for taking the time to present today. I would say if you're not planning to, I can see Gronya there. I think she'll be calling upon you with Judy to get involved in the implementation of the strategy. And well done on all your work.
Thank you, Marie.
So I'm delighted to introduce our fourth panellist, Miss Neve Walsh. And Neve is a full-time PhD researcher with Ulster University and the NMPDU in the Northwest. And Neve, I suppose we were particularly drawn as the panel who were shortlisting the submissions to the title of your submission, which was Opportunities in the Midst of a Pandemic. And then upon reading it and speaking with you, it really is amazing how you really saw an opportunity in the midst of a crisis. And I'm sure our listeners would love to hear about that. So could you tell us about that?
Marie, and to you and your team for accepting the submission. We're really delighted to be able to get to share our work with you and across the country, and share, like Majella has said, what we have achieved through this crisis. So we like everyone else started to develop items locally for our services, easy read materials, etc. We are a funded Sláinte Care initiative, the HSE Health Passport. So that was paused in March. So we were working locally then in relation to easy read materials like that, going for a test, what the pandemic is, what cocooning is, etc. These materials fell across the desk, I suppose, of HSE communications team, and Miss Norma Deasy, if it's okay to name her, got in contact with us in relation to developing some materials for the Department of Health in conjunction with them. We work with a team of people, and our team of people include people with intellectual disabilities themselves, and they are our co-collaborators, Mr. Paul Gallen and Miss Geraldine Rabbit. So we've worked closely with them on other projects, and they were very much part of this space going forward as well. So that's really how we saw this opportunity come our way, and we grabbed it with both hands. Yeah.
Absolutely, and you're absolutely right to do that, Neve, and well done to you and your colleagues. Could you tell us a little bit about the materials you've developed, and especially I'd like to hear about the feedback as well.
Okay, so just to name some of the documents, because there were so many, we developed the cocooning document, travel document, the self-isolation and restricted movements document. In relation to the feedback that we got, the International Protection Accommodation Services saw the self-isolation document that we had produced for the Department of Health through the HSE communications team, and they contacted that team and asked, could we do one specifically for them. There was very little amendments to be made, and what was really wonderful about that piece of work was that people in generic services were coming to intellectual disability services and saying, we like what you have, we like what you've produced, and we would like that to be able to support the people that we support. So these documents are not just intended for people with intellectual disabilities, they are intended for a much far-reaching group. And so I think that is a real feather in our cap as RNIDs. It's a feather in our cap, and it shows real leadership in what we can do and what we can achieve in conjunction and in collaboration with people with intellectual disabilities themselves. And just to say as well that the piece of work that we developed for the International Protection Accommodation Services, which were 2 documents, the isolation one and the restricted one. The self-isolation document was subsequently converted into 10 different languages, which is just wonderful. That document was circulated further into Northern Ireland, and it was brought to the Northern Ireland Assembly to support and inform the COVID response there. So we've had really, it has absolutely grown legs and grown far and wide. And to think that these documents are being sought after by people outside of intellectual disability is just a massive achievement.
Absolutely, Neve, and it's just fabulous to hear that, and well done to everybody involved. I suppose what I'd love to hear about is, your success is amazing. So could you tell us what's influenced the success of this initiative?
I guess really for me, the influence of, if you talk about influence and you talk about success, for me it's working and collaborating extremely closely with people with intellectual disabilities themselves. They will tell us what it is that they need in a document. I mean, we have so much health literature out there that, and we're bombarded with it ourselves every day. And it's sometimes we get materials ourselves that we find difficult to understand, and we will reach for the shortened version or the synopsis of or whatever. And so, I had a really interesting conversation with one of the HSE communications teams, because we worked on the national flu campaign. We developed easy read materials for the children's and the generic piece of information. We also worked on the Scopy study. We developed the easy read participant information sheet for that. And we've also worked on the survey that has gone out just recently for the virtual platforms, where the people who have been working in relation to virtual platforms, like Gronya, Magella and Evelyn have already highlighted, they're looking at the experience of people using those platforms. And so it was wonderful to see that people now see that access for all populations to easy read materials, to be inclusive of those people at all levels, be it research, just a survey, is really important. It's really important to capture the views of all members of society and how that's being experienced for them. So that to me is a sign of success. None of which would have happened without our core collaborators, Paul Gallen and Geraldine Rabbit. And again, a team that we're planning on building and developing, and we've secured funding to further develop that team. So yes, when we go back to what you asked, the success of this, Marie, I would have to say has to be having people with intellectual disability have the final say.
And Neve, you really should be so proud of this success. It's been really fantastic, and for everybody involved as well. And I know from speaking to you, Neve, and you alluded to it a little bit in your answer to question 2, this initiative hasn't just had benefits for intellectual disability, it's had benefits that are being far-reaching within healthcare and outside of healthcare. And I know you've mentioned some of them, but maybe you'd like to say a little bit more about that, because I think our listeners would be really interested to hear that.
Yeah, and I think, I suppose it's a philosophy that I sort of base everything on. I just think, people with intellectual disability want just what we want. They don't want anything more, and certainly don't want anything less. And in relation to some of the areas that we were invited to develop easy read materials for, such as the Scopy study that I mentioned earlier on, and the virtual platform study, we got feedback from the Scopy study team, which comprises the HSE, UCD and HSCP. And what they said was that they had 5 participants who agreed to participate in that study based on the fact that they were able to access an easy to read participant information sheet, which for those of you involved in research, is critical to people to be part of any piece of research. This is a very invasive piece of research because it requires blood sampling to be carried out over a long period of time. But this piece of research is going to feed into the national COVID response and the world COVID response, because the results from that study will inform not only the European response, but the World Health Organization response as well. So really, to be able to include people with intellectual disability in a meaningful way in clinical research is a wonderful thing to be able to achieve. But what I would add to that is, and I might have mentioned it early on, there was a lovely comment made by the HSE communications team, having worked closely with them over the last number of months. And what they said was, we probably should be looking at easy read materials first. And I just went, hallelujah, these people now are singing my tune, because, and the tune of every RNID, I'm sure, in the country. I can see Gronya smiling there. And it just landed. I just thought, they get it. They absolutely get where we're coming from. And my philosophy is, and that of many people I work with, when we get it right for people with intellectual disability, we have a very firm, solid foundation that we get these materials right for everyone. And we have evidenced that in the demand on our team from people outside of intellectual disability. And this is where we need to stand up and show our real leadership and say, look, here we are, we're RNIDs, this is what we do it really well. Come, let us sit at your table and we're happy to sit at yours, with our co-collaborators, with people with intellectual disability who make the single most biggest contribution to the materials we develop. So it's been a journey, and one that's continuing. And just to say, just recently we've had a request from HSE Communications again to develop their an easy read booklet in Keeping Well this winter, and that's a COVID specific booklet that they've already launched. So it's just wonderful to be a part of that agenda going forward, and that they're still seeking us to develop those materials. I mean, within organisations and within intellectual disability services, easy read materials are not new, but they're definitely new outside of it. Yeah.
Neve, it's been a pleasure listening to you. I think the work you're doing is fantastic with your co-collaborators. And I actually think the title was so fitting, Opportunities in the Midst of a Pandemic, because you certainly took the opportunity and you all went with it. And well done, and the best of luck with and wishing you continued success.
Thank you, Marie.
I'm now going to hand over to my colleague, Dr. Clare Lewis, and Clare has been taking notes throughout the webinar and will now present the key points that have been raised.
Thank you, Marie. And I think our expert panel have really demonstrated how, they're translating strategy into practice around shaping the future of intellectual disability nursing in Ireland. Just to begin, Gronya from St. Michael's House really showed the impact of following guidance around IPC measures and the impact it had in terms of hand washing, social distancing, physical distancing, and how they really supported the guidance in terms of implementation to support the health and well-being of individuals and staff to be able to deliver really high quality care and keep people safe and also being cognizant of health and well-being. And it was very much supported by that leadership at all levels and that team approach, and recognising the creativity and innovation of staff. And also it was very, very clear around the impact of social isolation. So the disruption in the change in routine, access to day services, and how that greater risk of social isolation impacted on people living with intellectual disabilities, and how they really looked at integration of services and capitalising on, the development of services such as that dedicated help phone line. That was wonderful to hear how it really supported service users, families and staff. And they've had 3,500 calls since March. And now they also looked at bespoke educational videos to really communicate that message and ensure that everybody was informed and reduce those anxiety levels and promote health and well-being. And the documentation to address the egress from the acute hospital and developing policies tailored to individual needs. And that innovation around social connectivity was very, very strong. In terms of Evelyn, it was in the dementia services in Tala. It was around the memory service and the importance of that early intervention, the screen and that whole person approach to assessment and ensuring timely service input and bespoke information tailored to the individual needs, and the importance of staff training around dementia awareness and MDT engagement and that end of life care to support service users, families at the end of life. And again, that common theme that's come through is the impact of COVID-19 in terms of restrictions and the difficulty in the disruption to the routine, and how they very much looked at tailoring their interventions and support, being very cognizant of that, capitalised on technology-enabled care delivery and new ways of working to keep people connected and communicate messages through media platforms. And what was very clear is the importance of developing those specialist practice and advanced practice roles to increase access and coverage for memory services in the context of intellectual disabilities. Majella in Cavan and Monaghan Disability Services, she really showed how that the importance of that therapeutic engagement and capitalising on therapeutic interventions because of the disruption around routine and social interaction and seeing family members. And it was again supported at leadership at all levels with that collegiality with senior management and frontline staff. And the communication was very high context. So they were using on the ground, they were looking at online learning, media platforms. And what was very clear is how that we need to look as we move forward, developing those telemedicine approaches in intellectual disabilities. And it was so wonderful to hear how Majella really was embedded in the everyday practice and really supporting frontline staff and being with service users, residents, to have that very much person-centered approach and really get to know what the experiences and you know, the wishes of the individuals and staff, and the importance again of developing those advanced practice and specialist roles as we move forward. And just finally, Neve really showed the opportunity that's been created in the midst of a crisis. So this evolved out of the work that she has been leading on the National Health Passport, and it was about developing easy read material and collaboration with communications, national communications in the HSE, to make sure that the community and society was kept abreast of you know, changes and really connect with the community and society. And what's wonderful to hear is how this easy read material is now translating into research and looking at informing the how we get information around the Scopy study, which is looking at how COVID-19 has spread in Ireland and what age groups have been affected. And what he really showed is that whole co-design, co-production piece around easy read material. And so it is extremely value driven, and it's those that are affected by the service that are best placed to design it. And this translates to all our developing easy read material and sharing their experiences, which it's just absolutely wonderful to hear. And I think all of our speakers today have really demonstrated how they strive to develop an environment and services that are very culture driven, values driven, person centered, and that quality of care to continually improve how we evolve and develop, not just in intellectual disabilities, but in populations as a whole. So thank you so much.
Thank you so much, Claire. And, you know, I really echo what you've said. And thank you so much to all the panelists. You've been absolutely excellent, and really, I think intellectual disability have been so well represented here today, both the staff, the teams and the service users. So thank you for taking the time to present and also to prepare for today. Our next webinar will be Nursing and Midwifery Clinical Leadership during COVID-19, sharing the learning from Children's Nursing Services. Thank you.